Ready?
Yeah.
Okay. So our presentation is on PTSD, post-traumatic stress disorder. I'm Erica Roberts.
And I'm Daniel Christie.
All right. So the history of PTSD, early years. This disorder has existed for about as long as humans could experience trauma, but it was not diagnosed as a true disorder until 1980. It was included in the Diagnostic and Statistical Manual by the American Psychological Association. Combat stress has been mentioned in passages from over 2,000 years ago in historical literature. The first mention of this combat stress was in the Battle of Marathon in 5th century ancient Greece. There was also documentation of PTSD flashbacks and recollection excerpts from the Hundred Years' War from 1337 to 1453. So here we have a couple paintings of these wars. So the first one on the left is the Battle of Marathon, and then the second one on the right is the Hundred Years' War. Next, we have the history of PTSD continued, 1800s to modern day. So, PTSD related to combat participation was merely dismissed as battle exhaustion or soldier's fatigue. It wasn't until the early 1900s that Sigmund Freud came up with the talking cure, which is one of the first known methods of treatment. In 1915, the term shell shock was introduced before the official diagnosis of post traumatic stress disorder in 1980. In the 1950s, people refused to admit to trauma symptoms due to stigma surrounding mental illness. Finally, in 1980, the disorder was adopted to the DSM, the Diagnostic and Statistical Manual of Mental Disorders. So the following is just a picture of Sigmund Freud on the left, and then on the right is just two pictures of soldiers depicting shell shock. As you can see, their eyes are wide, sort of having a glassy look over their eyes, and then they're covered in dirt from whatever war that they were in. So, what can cause PTSD? Can anyone be diagnosed? So, serious accidents, physical or sexual assault, childhood domestic abuse, exposure to traumatic events at work, serious health problems, childbirth experiences, war and conflict, torture can all cause PTSD. PTSD tends to develop in one third of people who experience some sort of trauma. Although anyone can be diagnosed with this disorder, you can be more susceptible to developing it if you have a history of depression or anxiety. In addition, genetic factors can play a part. A parent or grandparent with a mental health problem. Only a doctor, such as a psychiatrist or a psychologist, can diagnose someone with this disorder. A person must experience symptoms for at least a month before being diagnosed. So in these pictures, we have an example of just a near-death experience or a near-death injury. In the middle, we have war. And then on the far right side, we have abuse, physical abuse, and in a relationship or family. So why does PTSD develop? What are the symptoms? It is not clearly known the exact cause, but the following are possible reasons. As a survival mechanism, flashbacks force some people to think of the event so they're prepared for it if it happens again. High adrenaline levels. People produce high amounts of fight or flight hormones because it helps deaden senses and dull pain. Changes in the brain. The hippocampus appears smaller in patients with PTSD. So, some symptoms of PTSD would be reliving aspects of what happened, in other words, flashbacks or nightmares, alertness or feeling on edge, panicking, aggressive behavior, avoiding feelings or memories, having to keep busy, being unable to express affection, difficult beliefs or feelings, trust issues, and blaming yourself. As a side note, many sources of trauma are physical, but even psychological trauma can have lasting effects on a person.
So some of the triggers of PTSD, or just what a trigger is when you have PTSD, your symptoms can come and go, and you might feel fine until you hear a car backfire loudly, for example. So triggers include sensory things like sights, sounds, smells, and thoughts. The brain attaches these details to a specific traumatic memory. They act as buttons that tell your body that it's in danger, even if you're completely safe. And the sights, sounds, and feelings of trauma may come rushing back, and these are called flashbacks. So there are many types of PTSD trauma. It can come from a lot of different things. Usually it's, seen in military veterans when they are readjusting to life outside of the military, and they find it hard to cope with the harsh experiences of their active service. They feel on edge, emotionally numb, and disconnected. Emotional and psychological trauma. So you can get PTSD from experiencing extremely stressful events. This type of PTSD often has links to childhood trauma. Things that trigger this type of PTSD include an accident, injury, sudden death of a loved one, bullying, domestic abuse, or deeply humiliating experiences. Rape and sexual assault is also linked to PTSD. PTSD forms from the trauma of being sexually assaulted or raped. It's common in victims of human trafficking and children and women. And racial trauma. So this stems from exposure to racist abuse, discrimination, or injustice. It can erode your self-worth and lead to anxiety, depression, chronic stress, high blood pressure, eating disorders, substance abuse, and even symptoms of PTSD. So here are some images of these different types of trauma, just to give you an idea of an example of what they might look like or how people might react to them. So there's a lot of ways to manage symptoms of trauma. Obviously, you can go to a therapist or a doctor and get treatments like trauma-focused psychotherapy, as well as medications to manage some of these symptoms. But there's a number of healthy ways of coping with anxiety that aren't necessarily related to going to the doctor's office. These strategies help reduce the intensity of anxiety, they lessen its frequency and or make it tolerable. So some of these techniques are deep breathing, progressive muscle relaxation, mindfulness, self-monitoring, social support, distraction, and behavioral activation. So a lot of these techniques have to do with keeping your mind occupied, and also sort of like trying to either escape the feelings of anxiety or take them on, like look at them head on. So social support groups, you sit in these groups and you talk about your feelings, and you sort of face your trauma head on, whereas behavioral activation and deep breathing and relaxation, you sort of escape your anxieties. So one of the main ways that doctor or therapists try to defend against the symptoms of PTSD is psychotherapy. So the main goals with psychotherapy are to improve your symptoms, teach you skills to deal with your symptoms, and restore your self-esteem. There are two ways to address the problems of PTSD through psychotherapy. One is trauma-focused interventions. So this is the facing your demons head on, so directly addressing memories of the traumatic event or thoughts and feelings related to the traumatic event. And then the other way is non-trauma focused interventions. So this is sort of skating around your trauma and dealing with issues indirectly. So aim to reduce PTSD symptoms, but not directly targeting thoughts, memories, and feelings related to the traumatic event. So medications and other treatments, because people with PTSD process threats differently, doctors often prescribe medications that ease the symptoms of PTSD. These medicines help you stop thinking about and reacting to what happened, including having nightmares and flashbacks. They can also help you have a more positive outlook on life and feel more normal again. And because people with PTSD are consistently trying to shut down emotional responses, they're often they're often left with a feeling of being emotionally cold and removed and depressed. So because depression is very common, doctors also often prescribe antidepressants. And that is our presentation. Thank you very much.
Thank you for watching.